Welcome to Career TV. My name is Sara Nelson. Today we are talking to Dr. Tom Rose. Okay, what is your profession here in Columbia?
I am a private practicing veterinarian, meaning I work at Rolling Hills Veterinary Hospital. I'm a small animal veterinarian, and specifically I work on dogs and cats here in Columbia. I've been doing that for about 25 years and enjoying doing that very much. So.
That's cool. Okay. What made you choose this type of work?
I think as a child, I always knew that I just loved animals. They were very interesting to me. I did not grow up on a farm or anything like that. Grew up in the city of in South County, St. Louis area. But I was very interested in animals. And then as I went along in my high school years and then into college, I knew I wanted to do something medical related. And veterinary medicine just always excited me. So continued to pursue that option, and here I am now 25 years later, a veterinarian. So,
what's a typical work day for you?
A typical work day for me, again, I deal with dogs and cats in my practice. There are other veterinarians that certainly do other types of animals, large animals, might specialize in other areas such as government related activities. And there are also those that specialize in just do certain types of things. Just like in human medicine, they may be surgeons or dermatologists or specialists in other areas. And typically in my day, I have to do all those things, be all those types of specialists to take care of animals. Again, I do dogs and cats. So most of my day is involved with working with healthy animals. If we think about us as when we were kids, we went to the doctor most of the time when we were healthy just to get checkups or to have vaccinations and keep us healthy. So most of my day is spent dealing with animals to keep them healthy, preventative medicine, but I do get sick animals that come in. So I have a cat that I brought today to kind of show you what I do a little bit. It's our cat, Sally. I'm going to step down here a second. Come here, Sally. She's being very happy here.
You're so
I'll bring her out here and look.
pretty.
So one of the next question that we have about what are some of the advantages and disadvantages of my job, the advantages I say about my job is that it's different every day. You never know what's going to walk into the door. You never really know what you're going to have or see. Certainly I work most of my cases by appointments, but we may have emergencies and things that come in. Just last night I had somebody call me because their dog had eaten one of their heart pills that they dropped on the floor. So we get situations where animals, they just don't know, they can't make choices for themselves. So, but a lot of my time is spent with the healthy animals, looking at them. The disadvantage or difficulty I have with this profession, as any veterinarian would have, is that they can't talk to us. So we have to use our senses. We have to be problem solvers to be able to tell what's going on, using our instruments such as our ophthalmoscopes and our otoscopes to look in their eyes and ears. And as you can imagine, our animals are not happy to be there a lot of times. So they're not as calm as Sally might be here, letting me do all these things. But that's the advantage again is that there's always it never gets boring. There's always something different every day that we're looking at.
Okay.
So.
All right. If you hire someone, what do you look for in an employee?
What we're looking for in an employee is certainly somebody that is comfortable with animals. I'm always amazed also at the pre-veterinary students that come in that actually they have allergies to dogs and cats. So it's probably not your profession that you want to get into if you have that problem. But we look for individuals that certainly have initiative. Especially in my practice where I have to be busy doing my job, that I want my employees to be able to have an initiative to know what they need to do to be able to do the jobs that they need to do without me always having to be following them around or helping them out. Certainly, there's always a period of training time that you'll have when you start any new job, but it's good to have people that have initiative. There is a lot of science involved with this, some math, but being comfortable with science and math, and you don't have to have extensive knowledge in math, but being able to figure out like dosages and things like that as we get medications. I certainly have to depend upon my people to be dependable, being there on time and those types of things, because we never know what we're going to see through the day, and we have to be ready for anything that might come up. So.
Okay. How might your job change in the next 5 to 10 years?
What I see changing a lot is technology. as we see in everything when we say about that. But being able to do, we're essentially able to do everything on an animal that they can do in a human. Actually, they've tested it out on animals first. So those are all available. Sometimes it just becomes a matter of what an individual, an owner wants to pay for that. But that is something that we'll see more of in the future. You know, we have options. For instance, I'll show you, I don't know if you can see it on the film, but as we use our senses, especially in our field where the animal can't talk to us, we hope for the owner to tell us information, but with the animal can't talk to us, the more that we can use technology and instrumentation to look inside that animal, look at their blood, maybe look at x-rays. For instance, we had a sick cat here that was sick. How do we know they're sick? Because they're not eating, one sign, or they're vomiting or something like that. The yucky stuff like that I always tell people, if you want to get into veterinary medicine, you better be comfortable with yucky stuff because you're going to see it vomiting and diarrhea every day. You're going to see animals doing that. This was an example of a cat that I needed to look inside because it was acting sick and seemed sore in its belly. And I don't know if you can see it, but on this x-ray, this picture of his body, this is his belly. People think that's his heart, but that's actually his kidneys in there. And what he had done, he had a little something in there, and it was actually a toy skeleton head. The cat, it was Halloween time, and the cat had eaten a toy skeleton. So the technology that we can utilize, this is actually old technology, radiology, but you hear about having CT scans and MRIs and all that. They do that on animals as well to be able to specifically diagnose things and then hopefully be able to treat those. And we see more and more with that, and prices have actually come down for those, and we have owners that they're wanting to do that for the animal. They're their beloved pet. For many families, that maybe a young couple that don't have kids, that's their child in essence. So, so it's definitely a technology, and the medicines that we have available to treat those things that they're developing for people, they're developing for animals too. So
that's good. Okay. Well, what did you learn in school that helped you most in your job?
I think one of the things that helped me, as Sally's going to come into my lap here, is to be a problem solver. Okay. Certainly, we had to use a lot of science and math. You wanted to do well in those in high school level, you know, in college too. You had to take those courses, do well in those, but also just being able to solve those problems. And another thing that was very important, as I said, the animals can't talk to me. Yeah. So I had to be able to communicate with the owners and try to determine, you know, this owner that had this cat that had this skeleton head stuck in its stomach, they didn't tell us that till after we took the x-ray. They knew that the animal had eaten that. But then after we took the x-ray, they said, oh yeah, he did that. Okay, well that's his problem. And then we had to solve the problem by doing surgery to get that out. But really, you know, communication skills are an important aspect too. So.
Okay. What do you wish you had studied more in school?
I think probably, I don't think that I did as many, at least if they were available at my high school level, as far as like some of the animal science things. I don't know if they were available in my high school, but I think, you know, more of the high schools have those type of opportunities and career classes and things that would have been nice to have had some of those backgrounds. So
here we are at the last question.
Okay.
If you could go back in time and talk to your teenage self, what would you say?
I would say one thing, and not necessarily related to veterinary medicine, but be open to anything and any possibilities. Don't limit yourself, because you never know what might come up in the future. Okay.
All right. Well, thank you for
All right.
coming. Thank you.
Say, Sally, you did very good. You're welcome.
Okay. Thank you for watching Career TV. Tune in next time.